Good day, Wonder Nurses. I'm Nurse Anne. Today, we will tackle various types of anemia, and I will discuss it in a simplified way possible. So if you're ready, let's start. Let's begin with the basic. What are the things that we need to remember about the red blood cells? It is also called erythrocytes. It is for oxygen transport. It contains a special protein called hemoglobin, which helps carry oxygen from our lungs to the rest of the body and then returns carbon dioxide from the body to the lungs to be exhaled. The normal count is 4 to 6 million cells per microliter. It is formed in the red bone marrow. Erythropoiesis. It is the process by which human erythrocytes or RBC is produced. Erythropoietin is a hormone produced primarily by the kidneys, and it stimulates the bone marrow cells to produce RBC. Now we can proceed. First, aplastic anemia. It occurs when your bone marrow stops producing enough new blood cells. Sometimes it stops producing one type only, but more often it affects the red blood cells, white blood cells, and platelets. It can be inherited or acquired. In inherited aplastic anemia, it is caused by gene defects and it is common in children and young adults. While acquired aplastic anemia, researchers believe that something triggered the immune system like viruses, medications, toxins, or radiation. Since it affects the RBC, WBC, and platelets, the three main manifestations are easy fatigability due to low RBC, presence of infections due to the low WBC, and easy bruising and bleeding due to a low platelet count. Bone marrow biopsy is the confirmatory test. Treatment includes blood transfusions, immunosuppressants if it is due to an autoimmune disorder, and stem cell or bone marrow transplant for severe cases. Iron deficiency anemia. It is the most common type of anemia, and it occurs when the body does not have enough iron. Iron is important because it is needed to produce enough hemoglobin. Hemoglobin is the part of red blood cells that gives blood its red color and enables the RBC to carry oxygenated blood throughout the body. Causes: blood loss, pregnancy, lack of iron in the diet, and inability to absorb iron. Key manifestations include extreme fatigue, weakness, and pale skin. Diagnostic tests: blood tests that include CBC and serum ferritin level. Low levels of ferritin are indicative of iron deficiency anemia. Prevention and management: choose iron-rich foods like red meat, spinach, and seafood. Take vitamin C or citrus juice to enhance iron absorption. Sickle cell anemia or sickle cell disease. It is an inherited blood disorder in which there is not enough healthy red blood cells to carry oxygen throughout the body. Normally, the shape of the RBC is like a disc, which gives them flexibility to travel even in the smallest blood vessels. But in sickle cell anemia, RBCs have an abnormal crescent shape resembling a sickle. This makes them sticky, rigid, and prone to getting trapped in small vessels, which blocks blood from reaching different parts of the body. This can cause pain and tissue damage. Sickle blood cells are also destroyed faster than the normal blood cells, and this causes anemia. A blood test or genetic test may be done to confirm the diagnosis of sickle cell anemia. The management focuses on avoiding pain episodes, relieving symptoms, and preventing complications. Treatment includes medications, blood transfusions, and stem cell transplant. Hemolytic anemia. It is a disorder in which red blood cells are destroyed faster than they can be made. The destruction of RBC is called hemolysis. The normal lifespan of RBC is around 120 days. Anemia will happen when the bone marrow production can no longer compensate the premature destruction of RBC. Causes: inherited disorders like sickle cell anemia or thalassemia. Autoimmune disorders, infections, medications, or bone marrow failure. Key manifestations: dizziness, fatigue, and confusion. Diagnostic tests: peripheral smear and reticulocyte count are the most important tests to diagnose hemolysis. Treatment: blood transfusion, immunosuppressants like corticosteroid if the region is autoimmune, and in severe cases, surgery may be done. The spleen may need to be removed because it is where the red blood cells are being destroyed. Pernicious anemia. It is a condition in which the body cannot make enough red blood cells because it does not have adequate vitamin B12. Vitamin B12 is needed to facilitate proper red blood cell production and function in the body. Causes: lack of intrinsic factor. It is a protein in the stomach needed by the body to be able to absorb vitamin B12. Autoimmune disease. It is when the body's own immune system attacks the intrinsic factor that is necessary for the absorption of vitamin B12. Lack of vitamin B12 in the diet. It can be found on poultry products, shellfish, and meat. Key manifestations: red tongue and nerve damage, like tingling or numbness of extremities. Diagnostics include blood tests and antibody tests. This is to check for antibodies to intrinsic factor. Its presence will indicate pernicious anemia. Treatment: vitamin B12 shots or pills.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.